Daily Planet Health Services has committed themselves to improving the health and well-being for underserved patients. They have impacted tens of thousands through the provision of a full range of health-related services to individuals and families experiencing or at risk of homelessness. With an established academic community partnership with Virginia Commonwealth University School of Pharmacy, Daily Planet Health Services has garnered multiple awards for providing programs that assist patients and their caregivers in achieving better outcomes.
So I am Dr. Patricia Cook. I am the Chief Medical Officer here at Daily Planet Health Services. Daily Planet Health Services is a federally qualified healthcare center with a special populations focus on healthcare for the homeless and healthcare for people living in public housing.
And so our services are pretty broad. So in the pharmacy clinic, we do medication related work. So we help with access to medications. We help with medication related problems, with medication reviews. We have a program for high-risk diabetes patients, our Diabetes Impact program that I see patients with the healthcare provider, currently Dr. Cook, who is our Chief Medical Officer. We also run the immunization program for Daily Planet. We do smoking or tobacco cessation. We help patients with wellness visits. We do screenings, outreach to the shelters. We're also helping with prior authorizations, medication refills. So pretty comprehensive when it looks at the pharmacist as being part of the healthcare team.
So the Diabetes Impact program is, we use a team-based approach. And so we've got Dr. Cook, the medical director, and then Dr. Good, the pharmacist, and then myself, the health educator. And we all collaborate and work together when seeing patients for their appointments, and then also for the group education piece, which is the lunch classes that typically Dr. Good and I are doing on those diabetes clinic days. And so we try to address, both the education and the group piece, and having lunch together, which is also part of the education, but also just a great way to come together and learn and share. Our partnership with VCU, and particularly, Dr. Good and the pharmacy students that it brings, it really allows us to have that more well-rounded team-based approach and team-based care. And so we have more access to resources, to human resources, and also just the time to do this sort of a program, which I think, clinic days are busy, and having, students and a pharmacist and having, the health educator and all of these pieces that can come together and work together it's really special and kind of hard to find sometimes. And I love that about Daily Planet, that we are in the community really involved with our partners.
I'm Pam Mentor, and I work for the Daily Planet. I'm the Medication Assistant Program Coordinator, and I help patients maneuver through several avenues that we have to receive free medication through the RX Relief Program. We also partner with a local pharmacy, Common Share, where it bridges the patient until they apply for Medicaid and get approved. I will also go pick up the medicine for the patient, because some patients don't have the resources to go pick up the medicine, and they can easily get to us if I bring the medication to them. This is what I do to connect the dots for those in need.
We are fortunate at Daily Planet to have a collaborative agreement with VCU School of Pharmacy that involves having their community pharmacy residents embedded in our clinic. What that means is we get two professors, Dr. Gatewood and Dr. Good, who bring pharmacy residents every year, as well as pharmacy students, into our clinic. And they help to educate our patients about how to best access their medications, how to best administer their medications, and learning all of the information about their medications. So our pharmacy team meets with patients. They educate patients. They create systems where some of our patients who have lower levels of literacy are able to take their medicines, and they help our providers tailor medication regimens to our patients who may not have refrigeration or shelter or a safe place to store their medicines every day.
the APhA Foundation Pinnacle Award is a national award and gets many applications every year. And so, like you said, you know what you do, but everybody else doesn't always know what's going on in the setting that you're in. And so working with these patients on a daily basis, on a weekly basis for several years, and kind of seeing, because that award really focused on the pharmacy services that we have here at Daily Planet, because we know Daily Planet does a lot of things for the community and their patients. And so to be able to be recognized for that and have other people be able to see nationally compared to other things that are going on with pharmacist services nationally is very humbling.